Welcome to the first installment of the Dental Spotlight podcast. This week we interviewed Dr. Ronald Hecker. He's an excellent friend and fantastic dentist. We talk a lot about his background, his hobbies, what he loves to do, and just get a really good idea of what he's about personally, professionally, and enjoy. So welcome to our first installment of the Practice Spotlight podcast. We interview the greats in the field of dentistry to give our listeners some of the latest that modern dentistry has to offer, as well as a better idea of the person treating them behind the surgical mask. As our very first guest, we are so excited to welcome Dr. Ronald Hecker. Dr. Hecker is a Brooklyn native who has been practicing in his hometown since graduating NYU School of Dentistry in 1977.
1977, yeah.
His practice is located on 81st and Bay Parkway in Bensonhurst. Where he's been for as long as I've had the pleasure to work with him. Welcome, Dr. Hecker.
Thank you for having me.
So before we get into dentistry, tell me a little bit about your upbringing. Where are you from? Where you went to school? Things like that.
Well, Brooklyn, actually born in Maryland, but I lived in Manhattan. But basically most of my childhood and adult life is Brooklyn. And Midwood High School, Brooklyn College, and then NYU Dental School. I graduated in dental school when there was a shortage of dentists, and they actually offered a 3-year program in those years. So
oh, wow.
I was actually able to do dental school in 3 years. So
oh, fantastic.
Instead of 4 years of torture, it was 3 years of torture, but it was well served. Afterwards, it was a residency for a year. Tremendous proponent of residencies, and at the time that I took it, they were optional. There was only one residency available for every 3 graduate dentists, so they could not insist on every dentist getting it, although now rules have changed in New York and dentists must take residencies, and that was a really good addition to the state law, having to take residencies. My understanding of dentistry came after dental school. Dental school gives you the tools on how to work, but not the nuance, and it's the nuance that makes the difference to provide a service.
Absolutely, yeah. Repetition is a big part of dentistry. Just doing the same thing over and over and over again. You got to just have reps to be good at it. New Jersey still does not have a residency requirement,
and neither does Connecticut. So you have some young dentists that are trying to avoid a residency. They may go to New Jersey or Connecticut for treatment for a couple of years, then they come to New York and apply for a license. But I think the residency is very valuable. There's always choices in treatment plans, and in dental school they're teaching you one way, a successful way, but a rudimentary way on how to get from A to B.
Sure.
And there's really a lot of roads that go from A to B, and you have to figure out which is the best for that patient, and that's what you get in a residency. And that's what you get with experience.
Yeah, absolutely. Yeah, I couldn't agree more. The way we treat patients that we started treating 10 to 12 years ago together, totally different how things we do now. Not to say that those were bad, but as we've just done more and more and more, you can always tweak and nuance these things just to be a little better and better. And yeah, it changes absolutely. So the more experience you have, for sure, changes everything.
And 100%, dentistry is about change. When I was in dental school in '77, dental implants that we're going to be talking about they were poo-pooed. It doesn't work. It's not right. It's not approved. You'll get infections. All kinds of stories about dental implants. Left dental school saying dental implants is not good for anyone. And then in my residency, I lectures from some of the Webbers and the Linkows and the Cranins of the years past. And you learn that what you learned. Look, science changes too. At one time, we only had a certain number of planets, and now we know there are a lot of planets out there.
Absolutely.
So dentistry has changed, like science has changed, and implants is tremendous improvement upon the service that we can give patients. When I started dentistry, dentures, I was doing hundreds of dentures. Now, if I do a couple a month, it's a lot, because we know that dentures really is a tough road for the patient when we can offer them something stationary fixed that you can actually chew with, as opposed to something that you're a piece of plastic that's sitting in the roof of your palate. So
sure, absolutely.
Things change.
Yeah, 100%. And even the way we used to do implants, where there's a denture was a mandatory stage if someone was losing all of their teeth. in between having fixed teeth, where nowadays that's already even, we have it available, but I would say we use it in maybe 5 to 10% of cases. Everybody else walks out, with a full set of teeth that day that they're obviously, taking it easy on for the first while when things are healing. But yeah, massive change. And I tell people, there's nuanced differences between their implant teeth versus their natural teeth. Natural teeth, we all agree, are still the best. We want to keep those. Our prevention in dentistry is still the most important, but almost we lose that stage of dentures are way better than no teeth, but it's a far cry from what fixed teeth are, for sure. And yeah, just to be able to give that ability to our patients to have to skip that denture stage is a huge change.
From a biomechanical standpoint, you're 100% right. That denture, for the patient to get used to a fixed temporary and leave with teeth, paves the way for success in the ultimate bridge that they get maybe 4 months, 3, 4, 6 months later, because the muscles of the mouth, the tongue, the lips, they're getting used to a different environment in the temporary stage, which makes the final stage so much better. When you have to go from a denture even to fixed, it's a little bit more difficult for the patient. So the fact that, the process that you use, I know for patients to leave with something that they can chew with is a big plus over something that's removable when the patient doesn't need to have something removable.
Absolutely.
I look at it like patient with a bad hip. You can get around in a wheelchair, but my gosh, if you get that hip done and it's successful,
great analogy.
When you leave the hospital, you go slow. You go for physical therapy, but you leave the hospital. They won't let you leave the hospital with a new hip unless you can walk.
Right.
Well,
that's a huge change.
Huge change. Unfortunately, a family member not too long ago had a stroke. She went to a terrific Rusk Institute, a terrific place for rehab, and they would not give her a cane or a walker. They said, you must learn how to walk without a cane or a walker, because once you get the cane or walker, you're dependent upon that,
sure.
and you'll never be able to walk again. And this person who I adore, a family member, left rehab, and she's walking today without a cane or a walker. And that's the difference between, a denture, I can make do, I can kind of eat, I can take it out at night, but what they're missing out in their life by not having something stationary they can chew with is a tremendous
Absolutely. I think it's a great analogy. Let's see, back to yourself a little bit. We'll talk more about dentistry in a little bit. Let's say, what were some of the, fond memories growing up in Brooklyn? This is, you've been here for most of your life. What are some fond memories of days passed in Brooklyn?
Well, Brooklyn, it's punch bowl and stick ball in the streets, and it's, you don't have to go to day camp or sleepaway camp. Instead, you ring the doorbell of the guy next door. I would take a little walk down the block and go to Midwood Field and play paddleball. So the memories of Brooklyn is independence as a youngster, walking to your elementary school, not having to be picked up, or play dates. What's a play date? The play date was, ringing the doorbell across the street. So Brooklyn was like a big playground. Right now it's July. It's really hot outside. Brooklyn in July was beautiful. We got a couple of dog days of summer in August, a couple of hot days, and today we're experiencing that throughout the summer. So Brooklyn's changed, but demographics change, and you just gotta go with the flow. But it's a great place, and I meet people all the time, and you start to go back, 3 degrees of separation, 7 degrees separation. All roads lead back to Brooklyn.
Absolutely.
Brooklyn's a great place.
For sure.
And right now Brooklyn has the Mets in first and the Yankees in first, so it'll be a great place for baseball.
Absolutely. Let's say you brought up sports. I feel like you can't go to your office without noticing the sports memorabilia on the wall. The biggest one I've seen is tennis. There's some Mets representation, but tennis is the biggest one. What's your affinity to tennis?
Well, friends, the U.S. Open's a lot of fun. I go there, try to get there every year. and I just enjoyed. I enjoyed playing tennis. In my youth, and now I play with my kids a bit when we can. But it's just a fun sport. I grew up with the John McEnroe, Jimmy Connors matches, and Bjorn Borg, and all the names of tennis, and it was always a lot of fun for me. So I would go every year and pick up a poster. And then I would take the poster and put it in a frame, and take my ticket, stick it in the corner of the poster, and that's my artwork.
That's great.
It's not a Salvador Dali, but
it's you, exactly.
For $20 for a poster, it works well.
So Dr. Goff, the other dentist in his practice, when he grew up through the Florida circuit of up and coming professionals, and he spent all of his high school in Florida, away from his parents, in boarding school. In the serious tennis, he played against Andre Agassi growing up. He played against some real big pros. He was just actually on vacation, and he went to Wimbledon. He got to play with, I forgot the name of the professional he played with. He said a 7-year-old who used to be #1 in the world. I'll have to fill that in after edit. But he played on the grass in Wimbledon. He actually took a little piece of grass home with him. So I wonder if you talk tennis with him. He loves it also. He said he got to play a few times at the U.S. Open during the amateur circuits. And he's still really good, so he's won some of those tournaments, which allows him to play against some other professionals. So yeah, he really enjoys tennis as well. The professional thing, thankfully for us, the professional ranks were not in the cards for him, but he's still. I guess when you get that good as an amateur, you don't lose all of it, right? So you always go back.
It's fun. It's fun. One of my patients had took a trip. Loves tennis. Lovely couple. I've been treating them for so many years. They went to the French Open this year.
Oh wow!
And through customs and the planes and everything else, they actually brought me back a poster for the French Open. So
so that's going to put on the wall as well.
Looking forward to putting
addition.
it on the wall. Yeah.
That's fantastic. Let's see. Just going back a little bit, when you were in school, you went to undergrad in
undergraduate was Brooklyn College.
Brooklyn College.
Yeah.
Were you full-time student? Were you working part-time?
No. I was a full-time student. At Brooklyn College, and then when I got out of college, I really wasn't sure precisely what I wanted to do. I'd taken the LSATs and considered law school. I took the DATs, dental school, and what I did is I spent a year out of school. I worked at Brooklyn College at Brookdale Hospital.
Okay.
I worked at Brookdale Hospital as a dental assistant. I mean, I was right out of college. I cleaned the sinks and sterilized the instruments, but I would also follow the residents around, and I learned a little bit about dentistry before dental school. And having been exposed for a year working in a hospital, member of the 1199 union, and and I worked at that hospital as a dental assistant, and that's what made me decide that I preferred dentistry over other professional choices. And then after that year, I went to NYU in '74 and got out in '77 after 3 years.
I know you mentioned that you did something in the military for a little while.
No military.
No military.
No military. We're talking about graduating in Bidwood High School in 1969. I got a number like everybody else, and with bated breath. And it was a different era, Vietnam War, different attitudes in the country about military and stuff.
So it was your predecessor who had the military X-ray setups, right? Because your X-rays are always flipped.
Oh yeah, well, look, you X-rays are flipped, and I'm not sure where. When I first started in dentistry in '78, I did have a partner, a wonderful guy, who actually became a mentor of mine, and Dr. Freeling, and he was a terrific dentist, and that's how he mounted X-rays. So I mounted X-rays the same way, and Dr. Freeling and I had a great. We had partners, a great relationship. Unfortunately, I passed away. Then I took over his practice in Bensonhurst, and then continued on my own since then. Very nice.
So I guess that was your first professional mentor.
Well, yeah. After the residency, you meet a lot of people in the residency. When you get out of, I worked at 4 different offices. I worked 2 days in Bensonhurst, where I'm talking about. I also worked a couple days in Park Slope. I worked Saturday mornings in Stuytown in Manhattan. I worked Borough Park in the evening, so I was working all over the place. 4 different offices out of dental school, out of my residency. And I had a couple of offers in each of those places, but I chose Brooklyn to be my professional home.
That's great. Well, what other mentors have you, or people you looked up to, both in the field of dentistry and otherwise, that have helped kind of form you?
I think back, I think again, I always get back to this residency, and I had this fellow, Dr. Ahmed, who was a terrific guy, and he had initials for everything, and I bring that, when things are going rough, he would give me initials like CYB. CYB, what's CYB? I tell my kids CYB is count your blessings.
Okay.
A DIN. What's DIN? You're thinking about doing one thing or another. DIN, do it now. So if you're thinking about you have crummy teeth, you can't chew, you can't smile. DIN, do it now.
Absolutely.
This guy Henry was a lovely guy. He was actually a Marine in World War II, and that was his philosophy, and he was a big. He actually helped teach me a lot of my surgery and stuff. And what we would learn is preparation. Take a look at an X-ray. You're going to remove an impacted tooth. You don't go into the room and say, "Gee, what instruments do I need? What am I?" You think beforehand. You decide on your treatment plan and your path. And I'll bring in to my room a stack of 15 instruments and maybe only use one. But I want to be prepared.
Absolutely.
And not have to, in the middle of the procedure, ask my assistant, go into another room, I need a different size forceps. So it's preparation, having a logical path, knowing your goal. Knowing your goal becomes very important. You get your teeth treated at NYU in the dental school. It's a great dental school. I got trained there, but you might sit in that chair for an hour and a half for a simple filling. And the revolutions per minute that drill is going in that dentist's hand, 200,000 revolutions per minute. It takes him seconds to drill that hole, yet it'll take the young dentist an hour and a half to drill that hole. And the reason why it's taking him an hour and a half is not because the drill doesn't work, is because the dentist doesn't have a clear understanding of where he wants to end up.
Absolutely.
So you have to have a goal in mind, and you have to mentally decide on what path you're going to choose to get to that goal. And then it's life's experience. You always get thrown curveballs, and sometimes you do have to change, and you can't be obstinate and say, I must do it this way. A patient gags, or the saliva, or you're seating me too far back. You have to be a little flexible too, and adapt to the situation. But you really have to have that goal in mind. And that's kind of what I learned out of years ago, my residency. Preparation, know where you want to go, have the instruments at hand, so that you know what you want to achieve. If you know what you want to achieve, you can do that filling in 10 minutes. You don't have to sit there for an hour and a half because you're not sure how to angle that drill. You won't know where you want to go, and that's how you get it done.
Absolutely. I have this conversation with patients all the time. They see us for a brief period of time, we come in and out of the room, and they assume that's the entire interaction, but what I think a lot of them don't realize is how much planning goes into each procedure before, and both in terms of education first, in terms of the general procedure, and then in terms of how do I apply the specific procedures that I know. As we talked about, you have to have a large arsenal of what you can offer our patients in order to choose the right one for each patient. That decision making in advance that happens, and certainly in the surgical world, we're spending most of our time planning of what we're going to do, where do we need to go, and then working backwards how we're going to get there. And then by the time we get to the patient, it's hopefully a very quick and easy process.
100%. We spend time. You and I spend time
Absolutely.
on the phone
all
discussing
the time.
approaches on this particular patient. How many implants should we place them? And I always defer to your expertise, because with your level of training and of experience, I'll tell you, Robert, I'll take care of the aesthetics and the cosmetics and build a case at the end. You're the one that's going to really figure out on the placement and the numbers and the sizes. And some dentists that are not as experienced as you, which has an arsenal of choices in the office, Oh, I go to a dentist, he does his own implants, I get out. But he may only have one system, one size. And not every mouth fits that one system and one size.
Sure.
You know, I'll get calls from surgeons all the time. Which system do you want me to use? Certain or A, B, or C. And what I always tell the patient is, use the best system that works for the patient.
Absolutely.
As a restorative dentist, I'll figure out a way to make your job work, but the foundation is what you're doing. And when you put the implants in the right, the other thing is putting the implants in the right spot. You use guides, you do a terrific job, and you do it exactly where they're supposed to go. Makes my job a lot easier. If the surgeon puts an implant in a spot that's not conducive to a good restorative result, we jump through hoops to try to get it to work.
Sure, absolutely. And yeah, again, that just goes back to the planning. I think it's the biggest thing that I try to tell patients is that, you know, we see them for a consultation, we'll spend an hour oftentimes with the patient just gathering information. And at the end, we can then start to decide a plan. And I'll sometimes spend at least an hour, if not more, deciding what are we going to do for this person, planning whatever is going to be done. And then we present, we'll talk and say, okay, this person needs X, Y, and Z. This is the best way for you to get there. What are your concerns at the end of the final result? What are my concerns surgically? And marrying those two ideas together to come up with a full plan, that's the real dentistry that goes on. Executing it, you know, a monkey can execute a plan. It's a matter of the process that goes into the planning. That's really where it separates, you know, different dentists.
And the process is often about choices. You know, the patient that says to me, Ron, I trust you, just do what you gotta do. I'm not comfortable with that. I still say, I'm happy that you trust me. You know that I'm gonna suggest to do what's best for you, but you have to understand the choices.
Absolutely.
And there are choices. And then I never tell the patient, these are your choices, now you make the decision.
Right.
They will also tell you which of those choices I think will work best, but there are choices.
100%, yeah.
And you're not disparaging dentures. For some patients, it'll have to be a denture.
100%.
You know,
Absolutely.
Sometimes, you know, the surgery is daunting. Sometimes monetarily it's just not affordable. Sometimes medically you can't do certain things. So, you know, sometimes the patient still will have to walk out with a denture. But if they have the opportunity
Sure.
to get the fixed bridge, get the stationary bridge, that's a big plus. It's life-changing.
Yeah, absolutely. That's a great point you bring up. Actually, you know, I think in medicine sometimes this gets lost. Is that we're treating a human being here, right? This person needs to be not just the subject of our work. It needs to be the center of all the decisions. They obviously are relying on us for the expertise that we have to offer, but ultimately we're just here to try and help them. Right? So that they have to be actively involved in their treatment. I never want to do something to someone. We're doing something for someone. What can we do? My first question is, what can we do for you? We're here to see us for a specific dental problem. What can we do for you? How can we help you? And that's going to be how we're going to design everything back from that. I may have a great treatment option, but that's not what the patient's interested in. So they have to tell me what they're interested in. I give them the options of what modern dentistry has to offer. And from there, we can, start to go forward. But yeah, I think that's a lost piece in the medical world sometimes, is that the patient is the center of everything.
Patient is the center, and it's at the end of the day, it's a service business, and we have to give them the service, and the patient has to be happy. I never tell them, if a patient comes in to see me and they said, I'm coming to you because you're the best dentist, I said, well then go to another dentist, because I'm not the best dentist. I'm not the best dentist, but I can tell you that nobody will try harder and give you the options, and I'll give you my years of experience to tell you what works and what doesn't work. But there's no guarantees in life. There really is none, and sometimes things do go south, even with the best intentions. So I tell you, give the best intention, but life does throw you curveballs, and you have to deal with it.
Sure. And usually the person who goes around saying that they are the best dentist, that's usually not the guy who is.
Yeah, that's true. That's an element of humility.
100%. Absolutely. It's like the joke of you go and call someone a hero. If they respond to you and say, that's correct, I'm a hero, that guy's not a hero. If he says, no, it wasn't me, it was a great team and everyone worked together, hero. That's a guy. Good. Tell me a little bit about your office staff.
Well, I mean, with COVID stuff, we trimmed back a little bit, and all my staff have been working with me for a long time, and they're all hardworking, and they all understand the goal is again service. We want patients to be comfortable, and we want them to leave happy. And that doesn't say that. Again, it's the reality, the real world. Not everybody's always happy, but we try our best to do the service for the patient.
Absolutely. And what I've noticed with your staff is that these people have been with you, some of them literally from day one. Am I right?
Oh yeah, no, I have patients with me I have a staff with me for many, many years. I tell them that it's like a bad penny, you just can't get rid of them. But no, the patients, the staff have been with me for a very long time, and once they come in, they kind of like settle in. But I'm very happy with the people that do work for me, and and they continue to.
Right,
they all like what they do.
I think it's a great testament to the environment when you have staff that have been there for as long as they have, and you have a nice mix of young and old. We say like the sports analogy, right? You need to build a World Series team. You got to have the mix of the veterans and the young blood. But the fact that you've had so many staff that want to stay with you for tens of years is a great testament just to the environment that you have in the office. So I see that. All privately owned offices all have their own little flair to them, right? There's something about each dental office, I think, that reflects the personality of the dentist, the skills of the dentist. I would say, what is something that's either clinical, administrative, or social that gives your office kind of a unique flavor?
Well, it's the unique flavor is that I tell my patients, be careful what you're saying about somebody else. You don't know who's sitting next to you. I had once two brothers that hadn't some family dispute. They hadn't talked to each other in years, and they both had an appointment with me on the same day. And they meet in the waiting room. What are you doing here? What are you doing here? But they reunited and they left happy. I also had a husband and wife going through a divorce, and the husband says, "I hear her voice in the waiting room." I said, "Well, I'll let you out the back door." So you never know who you're going to speak to.
Did they get back together after that?
No,
they didn't.
The divorce did not happen. Divorce actually happened, and they didn't get together.
All right.
So you never know. So the unique flavor really is that we have even great-grandparents, grandparents, parents, and children all in the office, and when they come in, I saw you saw Johnny last week, and you have to think for the moment, the relationship. Oh, that's right, you're the aunt or uncle of Johnny that we saw last week.
Very nice.
So the flavor is really family dentistry. But I have no desire to open up 6 offices and hire 5 dentists out of school.
Right, totally different.
That's not my design.
Yeah, totally different. There's a model in dentistry of having a large corporate office, and there's certainly some benefits to it, but you lose that relationship. And again, a practice like yours, you've had these patients for. You're seeing how many generations have you seen altogether?
Oh, tremendous numbers since 1978. I tell young dentists when I used to go to study clubs, and I tell them that it's service. If you think of the letter S, and S for the word service, if you put 2 lines through the center of the S, it's a $. I said, don't go after. How can I make the most money on that particular patient, that particular?
Sure.
Instead, provide a service.
Absolutely.
And and the money will come later. That's not the issue.
I think that's great advice for any professional, right? If you're going after money, it's going to be very short-lived. You may make some money, but you're going to find it, lacking any true meaning. It's when you go after something you like, and then happen to make it a business as well.
I think service is important. Then again, I'm not driving a Mercedes. I drive a Honda, and I'm happy with my Honda, so that's okay.
If you did not become a dentist, what other field would you have been interested in?
Like I said, in college, I had taken the DATs as well as the LSATs, and I had applied to law school, and I had gotten into a couple. So I probably would have pursued law at least at that point, and that was my choice in those years, law and dentistry.
So Candace and I both mentioned that when we Google your name, I think there is a Ronald Hecker that shows up as a lawyer. Is that like your alter ego? No,
I don't treat.
That's funny. So what
other than just doing what you love, for a young dentist starting out, what are some of the considerations they should take at getting into the field? Even someone who's considering dentistry in general, what are some of the considerations they should take into account?
Dentistry is a tough profession today to get into because they're paying maybe $500,000 in tuition.
Absolutely.
My 3 years of dental school was around $30,000, you know, in 1977. So we're talking, you know, 15 times the fees, and they have large student loans to come out with. So it's difficult for me to be critical in how they approach their business. I don't approach dentistry as a business. I approach it as a profession. But a lot of young dentists, they are approaching it more as a business than as a profession, and for a good reason, in a sense, because they have to, they have those student loans and to come out with.
Sure.
But what I do tell young dentists is to be clinically proficient and also know your limitations. For instance, I've had implant companies, multiple implant companies, come into my office and say, "I'll give you the drills. I'll give you a free course. Use my company. How hard is it to drill a hole and put in an implant?" And I say, know your limitations. You might be able to do it for 20% of the cases, maybe 30% of the cases. But when you're thrown a curve, you need somebody with your expertise to really get a good feeling of where the mandibular nerve is, so we don't end up with a problem. Or to get a good feeling of where that sinus extends, or about the infection on an adjacent tooth, to have a bad outcome. So I think know your limitations. It's very important for the young dentist. Become clinically proficient, and don't, you know, pay your bills. That's important.
Sure.
But it's the service that you give, and that's what builds a practice for
Absolutely.
For the future.
Right. I think for anyone in the healthcare field, but I think dentistry specifically is you really have to want to be there to help patients is your driving force. After that, sure, you want to be able to make a living as well. But if that's not your main motivating factor, I feel like dentists can get burned out very, very quickly. Because as we know, it's a physically, mentally, emotionally demanding job. We see a lot of patients, and sometimes they're not their best state. They're in pain. They're suffering, and we have to make them as comfortable as possible. It's a very demanding profession. So if you're not in it because you want to help this person, the money will, is again very short-lived. It's you'll make money, but after a short period of time, you'll be burnt out.
The other thing I tell young dentists is to manage your expectations. You can't think that you're going to hit a home run every time. And you have to explain that to the patient, that this is what we're trying to achieve. And if all goes well, you'll achieve it. But you don't always achieve that home run. And the patient, if they understand the expectation of where you're going, they know that you have our full attention and we're trying our best. That's not a little thing. You're trying your best, you're trying to do what you can, but you have to manage the expectations. And what I tell young dentists is to really explain to the patient, you talk about initials and phrases. It's inform before you perform. Try to think of the worst outcomes and explain to the patient that, true, maybe that implant may not work out, but before we actually put in that restoration, we're going to test it. And if we have to change a process, we will. And ultimately, you'll be happy, but there's a path till you get there. So manage the expectations, and that's a very important thing. And try not to promise the world. Just promise what you really can deliver. And the only thing you really can deliver is your effort. Is your effort in trying to give them what you want, and you give them their expertise from the years. And then, of course, know your limitations and refer to surgeons like yourself for surgical procedures and difficult endodontics. You refer to endodontists for difficult procedures. A jack of all trades, master of none. You really have to know limitations, manage expectations, and have the patients value the patient.
Absolutely, absolutely. Any specific patient experience you could remember in all the years you've been doing this that you find meaningful? So it stuck with you.
No, look, a patient will come in for a routine cleaning, and then you look at that smile because of what we had done, 6 months before or 3 months before or 5 years before. And I always tell the patient, aren't we glad that you spent the effort, spent the money, and you got something done because it still looks good. And I think that's everything from a complete arch that we were talking about before to a single implant replacing that 1 second molar on the back. And I always pat the patient on the back. It's not because I did a good job or Dr. Mickley did a good job. It's because the patient decided to accept our treatment.
Absolutely.
And go ahead with it. And then I'm always telling the patient, look at what we did in that case. Look how nice it worked out. Look what a good job the surgeon did. I'm glad that it's still working, and that's the satisfaction of things going forward. People being basically satisfied with
Absolutely.
what they've done.
As you know, you treated many of my family members, and I saw one of my uncles the other night, and you did, I think 6 or 8 front crowns, and it was already a number of years ago. He looks great, so happy, and again, it's a investment in time, in money. There's a fear factor involved with just going forward with these things because it's been a certain way for so many years, and you're unhappy. But to make that effort to really go forward and take care of yourself is a big effort on the patient's part, and I think it's absolutely right. You got to congratulate the patients for taking care of themselves, allowing us to help them take care of themselves. But I always say to patients, you spent all this time and money, you went forward, you did it. It's done. It's great. You're so happy. How much can I pay you to undo it? Right now that we're done, and they'll always laugh and say like, you couldn't pay me the money we're to undo it. I wouldn't go back to the way I was living because I see I'm just so much happier with how things are now.
And a lot comes down to trust, because like I saw your uncle, not because he found me in the yellow pages or he Googled me. He saw me because you had recommended me. He trusted your recommendation, and then he trusted me, and I was able to perform. Trust is very
absolutely critically important for outcomes. So the patient, we have the patient's trust, and mutually we could trust the patients also to follow our instructions, take care of what we're doing. I think that's also a part that sometimes gets lost. Patients come in and said they feel like they're buying a product. I tell them, we're not buying a product here. I can hand you a set of teeth. They've got to work in your mouth, and for that to work, especially if we destroy one set of teeth, there's upkeep and care to make sure that we don't have the same problem again. There's nothing less satisfying than doing a great job of a rehabilitation of someone's mouth, and then they will equally not take care of it a second time and come back and everything's in shambles. That's a loss for everybody involved. So to really have patients partner with us in the treatment is, I think, critically important. It's a great way to put it. Of all the dental procedures that we do, what would you say is your favorite one? If you could narrow it down to one. I know it's like asking you which is your children's the favorite, but
yeah. The reality is, single implants, a couple of implants here and there, and restoring. That's fun to do. It's so routine. It's so quick. But the favorite stuff really is when we do those complete arches in those difficult cases, because there we get the tremendous sea change, really.
Yeah, absolutely.
In what you had and what. We recently did a difficult zygomatic together.
Sure.
We were able to put in zygomatic implants, cheekbone implants, and then attach that to a couple of others, and then restore a complete arch. To be able to allow a patient to walk out with teeth the same day and avoid 6 months of sinus lift surgery, and then first put the implants in and wear a denture maybe for a year.
Huge change.
That was one of the most impressive dental procedures that we've done recently. That was really a
absolutely
tremendous benefit.
And I love your analogy of the wheelchair. It's sometimes literally someone's in such bad shape. It's like, and then they come out and they're finished and they're smiling and they can chew and they can function. And the biggest thing, their teeth are not always on their mind. That they could just function their life without their teeth being the center of their attention. It's almost like getting someone to get up out of a wheelchair and go walk again. It's a massive change.
Go back to managing expectations again, and what you said in the beginning was very true. If what God gave us, our 28 or 32 teeth, could last, that's better than what we do. I'm not going to say for a moment that we improve what nature gave us. And it's still, you might finish a case and you still might whistle a little bit when a little air gets underneath. Or you might bite your cheek. Or maybe that front tooth is not quite in the spot that you would have liked it. we're not in the field of giving you perfection. We're in the field of trying to achieve as best a result as we can, given the biomechanical structure, given the physiology of your mouth, and we're not improving upon nature, but it's when nature has failed us.
Absolutely.
That's when we step in, and that's when we fix
Right.
it.
So I tell patients we're providing you with a prosthetic. It's an amazing prosthetic, right? But realize it's a prosthetic. It's, similar to if someone, God forbid, lose a limb. To be able to provide them with a prosthetic is a life-changing thing, but realize it's never going to be exactly the same as their natural limb. Of course, it's going to be a bit of a change, but it's a huge improvement.
And we love preserving enamel and preserving teeth. Patient will come in, I don't like the way they look, let's do 10 veneers. I'm not going to do it. 30-year-old, I'll do maybe some bleaching and some other stuff, but I like to preserve enamel, preserve teeth where possible. However, population is replete with people with teeth that just outlived their usefulness. We're living longer as a population. Our teeth are not living as long as we are. I've done not too long ago a 92-year-old implant that I finished up a case on. So it's not a question of how old the patient is. It's a question of, is there enough bone, the health of the bone, the health of the patient, and if there is, just do it. It's worth it. It's worth it. How many years do I have left? I get that from a 60-year-old. I'm 60 years old already. What do I need? 60 years old, you can live a lot more years. Leave your kids a few bucks less and chew comfortably. And that's what I tell them.
Absolutely. Right. Just take care of yourself. That's what you worked hard your whole life. We want to take care of our children, obviously, but not at the expense of yourself. Right. Certainly, you got to take care of yourself also. You can only be as great a parent, grandparent if you're in the best shape you could be as well, for sure. Let's see. The dentistry, we said, is always as much as it's great and we love doing it. It comes with its struggles and stresses as well. What would you say is the 1 to 3 things you find difficult about dentistry? Either the clinical aspects, administrative, patient-based. What do you find difficult about dentistry?
Oh, the difficult thing is the same thing that's plagued dentists for years. It's the physiology of the mouth. We're working underwater with materials that are not conducive with water. You have the tongue moving a mile a minute. The cheek, the patients are complaining. They're choking. They have to stop. They have to, and then we have to try to do a process and be careful for the cheek and be careful for the tongue. We want to take a careful impression, but sometimes the impression, then you tell the patient to bite down, and they bite down askew to the side, and then you try to so the challenges is still physiology, and then on those patients that for a variety of reasons do not do the implants, one of the tough things that has plagued dentists for a long time are lower dentures. And matter of fact, years ago, a dentist once told me that when a patient comes in for a top and bottom denture, they ask, like always, how much is it going to cost? And the dentist will say, well, your top denture cost $1,999, and the bottom denture costs you $1. You got to pay me $2,000, $1,999 for the top, and the bottom one for $1. They come back, you do the dentures, they pay their bill. I hate this bottom denture. I say, well, what do you expect for $1?
That's great.
So bottom dentures have plagued dentists for always and still do. There are no new, as far as I'm concerned, Fixodent and Polygrip and denture adhesives that the patients end up, piling on to help keep things straight. And then when the patient hates it or they feel it's affecting their digestion, you put in 4 implants on the bottom and take that denture and throw it away.
Absolutely, different world. For our listeners who are non-denture wearers, denture wearers understand exactly what you're talking about. For non-denture wearers who understand what we're talking about, the upper denture has a palate and it's kind of creates suction, so it can really hold down there. But the bottom one's really holding my gravity. And I think what people also don't realize is that the longer someone wears a denture for, that bone underneath the denture will continue to kind of erode away under the pressure of that denture. So I tell people, if you're going to go into a denture, just want to understand before you do that you may be limiting your options for the future. unless we look at it now.
That's 100% right. I mean, we have patients that have worn dentures at young ages, and now the ridge gets flatter and flatter and flatter,
Absolutely.
and the dentures move and move and move. Okay, I'll do implants now. But by now, you have a mandibular nerve that runs through the jaw. You have to take a careful scan, make sure there's room for an implant. There may not be, but if they had done the implants years before, the implant will preserve the bone around those implants. I hate saying for life because we're living a long time, but certainly for a very long time.
Absolutely. And I tell patients all the time, even if you're not going to go for the implants, at least have a consultation and understand what your options are. And we'll sometimes work with patients to make sure that, payments over years, just take care of step by step so that you don't end up without options in the future. That's one of the biggest, the hardest things. Thankfully, it doesn't happen too often. But one of the hardest things to tell someone is we can't do anything for you. It's just the situation is too far gone. This is really the best that you can have. And it's sometimes a very difficult situation. So those are always the hardest. So I tell people really get all your options first and then make a decision. And to also realize a non-decision is also a decision, right? If we decide I'm not going to do something, that's a decision, and that's going to have consequences. So to always make a decision based on the best information possible. Don't show up later and say I never knew. My dentist never told me that I had options out there that could take care of myself, and that I would lose those options if I just let things go.
And thankfully, the public, I think, is getting a little bit of that through. And you see people that are saying, I want to save my teeth more, whether it's root canals or crowns or dental implants. Dental implants have gotten to the point where I've had some patients, when faced with the choice, do I spend the money for an endodontist, post and crown, or do I spend the money for the implant? The endodontics, post and crown, maybe a few bucks less, but some patients will say to me, which will last longer? And now, the endodontic procedure, post and crown, or the one-tooth dental implant. And even though I have gray hair, and you might think I'm wed to endodontics, post and crowns, I tell the patient, I've seen endodontics, post and crowns done by wonderful endodontists, great posts, great crowns, and somehow the cement fails, a little saliva gets underneath, get a little decay, or pressure from chewing, and then there's a fracture in a root. I see really, once the implant is integrated, I see nothing is perfect. We go back to that. You can have a problem, but if you're dealing with the likelihood of a problem, a well-integrated implant, I think, is a more predictable long-term solution. The prosthetics on top, porcelain can break, may have to change a crown, teeth may shift a little, you may catch some food, you might have to change the crown, but the implant itself, once it's properly integrated, patient is not diabetic, they're not a smoker, they brush, there's a good chance that implant will outlive that endodontic post and crown. So,
it's always one of the hardest choices in dentistry to make, I think with a good prognosis, I think we'll all agree still a root canal with a good prognosis of a young patient is still a great way to go. A poor prognosis, I think everyone agrees that should definitely go for an implant. It's those moderate in-between prognosis, like this should work, this could work. Where do you go with that? Those are always a struggle for us to decide.
That's right. We're not talking about 40-year-olds, 40-year-olds short with the endodontics, post and crowns. Now you choose somebody that's 65 that already has bone loss in some of the teeth. Do we have them invest in the root canal, post and crown, or do you sink that implant in with good prognosis? Boy, at age 65, I would take the implant every day.
Yeah, I think that's sort of just comes with the wealth of experience. When you've done these enough and you've seen what works well over decades versus what will work well in a short term, and be able to, for that patient, tailor which direction to push them, and that's I think that makes all the difference, that diagnosis, for sure. So dentists love buying new equipment and technology. That's one of our things that we just love doing. What is the latest gadget that you've bought for your office? Something that's just...
I leave the technology more up to you. Like I said before, my gray hair is showing. But probably the biggest aid that I have in my office is the laser. And
That's
the laser
big.
really
Sure.
is a tremendous benefit. If there's some issue that does come up with an implant, you don't want to create heat with an electrosurge. You don't want to nick it with a drill. The laser is more kind to an implant procedure. And also when we take crown and bridge impressions, I use my laser as opposed to other techniques where I find you get more recession of the gum afterwards or more pain afterwards. So if I had to choose one thing, it's probably I'm on my 4th laser already. But,
Oh wow.
But because like everything else, technology changes. A laser doesn't last. The mechanics of building a laser becomes a little bit less. They just kind of wear out. But like I said, if the patient is looking for technology, I'm not the guy for you. I send the technology to you.
And that's also, that works, lean on the specialists around you to make sure you're utilizing all the technology without having to bring everything into your own place. Absolutely.
Oh, absolutely. Talk to the surgeon like yourself, and like I said before, know your limitations, and don't be afraid to pick up the phone and actually talk it through. And don't be afraid to disagree with the surgeon and tell them your view, and let the surgeon convince you why you're wrong. And I could be wrong, but I'll have to get convinced of why I'm wrong.
Absolutely. And what I tell young dentists also is that every salesperson is going to try and sell you everything, but then you're forced, if you invest heavy in technology that's really unnecessary for your practice, you're then forced to kind of defer that bill obviously to the patients, and it just puts an undue stress on the entire practice. You have to slowly move into everything in dentistry. Yes, get the latest technologies when it's appropriate for your practice, but lean on the specialists around you to get the best technology for your patients, but not necessarily having to make massive investments in your practice that the patients ultimately be paying for.
I think you also have to figure out what physiology is still the same. Whether 40 years ago, 50 years ago, or now, the tongue, the bone, the teeth, the physiology of what we have to work with is the same. So technology may make certain things go easy, but yet certain technology is indispensable. When you take a CBCT scan to know the volume of bone and whether we have enough bone to place an implant, any dentist that doesn't use a CBCT is treading on very thin ice. So you have to know which technology fits for
Absolutely.
that particular procedure. Other things are just a lot of bells and whistles to convince the patient why they're paying more money to you.
Right,
I'd rather
absolutely. Again, that just goes with experience of knowing what technology is going to really benefit the patients versus which is just going to be a show to kind of, have the patient feel that something's being used, but it's not really necessarily in their benefit. Absolutely. So the internet loves sharing life hacks. I'm sure you've seen those in every social media, life hack about this or that. What are some of the tips or secrets that you've learned that make life a little bit easier, either personally or professionally?
Well, I try to tell my staff that on time is 15 minutes early, and I think that if there's one feeling of today the people in today's generation is they pick up their phone and they say, well, according to Google Maps or Waze, I should get to that office in 22 minutes, and my appointment is 10 o'clock, so I'm going to leave 22 minutes before 10 and get there on time, only to find out that there's no parking.
Yeah, welcome to Brooklyn, exactly.
Only to find out that there's a garbage truck in front of them, a sanitation truck in front of them, and now they're going to be a half an hour late. Then they come into the office a half an hour late, and they say, how come you can't take me now? And I said, well, you're a half an hour late. The other person was there on time. Now you got to wait. Okay, how long? Another issue. I mean, how long? Well, do you want me to rush you when you're in the chair? I can't rush the patient as their appointment.
Sure.
Sit down and relax. So I think the one thing is 15 minutes early is on time.
Absolutely.
That's
that being said, I showed up 10 minutes late this morning.
You were late, but I was here.
You were here 15 minutes early? That is absolutely right.
Exactly.
15 minutes early. That is 100% right. Okay, words to live by. Okay, good advice from me. So working long hours, a lot of dentists do. Your website says that you start at 8:30 a.m. It doesn't even have an ending time.
I don't. Well, that's by design. Because if I tell the patient I work to 6, the patient says, well, I want your last appointment at 5:30. And I can't give everybody a 5:30 appointment.
Sure.
So I don't. I work, and then if I happen to get done early, I get out.
Right.
It's not like I have to stay there, but that's by design. I tell the patient, I like the patient when I start, because if the person had a problem over the weekend or the day before, I know he's in the next day, I'll call him. And with emergencies, we try our best to get in the patients, as soon as we can. But by design, I don't say when we end, because when we end is fluid, and it's a secret. So I'm not.
So when we end is fluid also, even though we have a set time, it still ends up being fluid. That's just the nature of taking care of people. But to do this again, as long as you have as many hours as you have, what are some of the things you do to stay physically, mentally strong to be able to go forward?
Well, I mean, it comes back to family. I have two wonderful kids. I have one granddaughter, and my daughter's due with her first, so soon I'll have two grandchildren. So, the family thing is still a very big deal. We talked a little bit about COVID before. I stopped going to, I still even till today don't go to indoor restaurants. I try to keep away. I haven't been exposed to the virus, and so I'm trying to stay as healthy as I can, and to be able to, you get sick. You get our president now has COVID. 5 days from now, he's going to be out and about. So 5 days, what's so bad? An unexpected close down in my office of 5 days.
Massive.
Which is
how many patients is that affecting?
Is rough. My hygienist is fully booked. I'm fully booked 3 weeks in advance. The reason for us talking today is because I enjoy what I'm doing and I'm happy to talk to you about it. It's not because I need more patients. I'm busy with what I have. So closing down for a week is rough. So I am extra vigilant, and but I get my solace from my family when I get home. I enjoy the kids, enjoy my wife. We have, we keep busy, and family vacations and stuff like that. But if you don't enjoy what you do, then it's a problem. If you enjoy what you work at, you don't work a day in your life.
Absolutely. Let's see, what are some of the more common myths that your patients have about dentistry that are not true? About oral health in general or dentistry specifically?
Well, first of all, patients come in with bad experiences, and they said, I had a horrible dentist. You know what? I don't think they had a horrible dentist. I think the dentist didn't communicate the problems that they had when they treated it. So the problem that is in communication. There can't be that many horrible dentists. There aren't. There are absolutely great dentists out there, but the communication sometimes is lacking. Sometimes it is difficult to get a patient numb, and sometimes they may need a second injection, or sometimes a root canal may require an extra visit, or sometimes you can't control when a person has pain after a procedure. Why am I in pain? It's not because the dentist was a horrible dentist. He did a root canal and the tooth had to be extracted. Well, sometimes teeth need to be extracted despite that. So I think the myth is we tend to blame others. It's not the horrible dentist, and I'm not saying to blame themselves. I'm just saying it's life.
Look at the bigger picture.
It's
Sure.
life.
Absolutely. Good. What is the best dental joke that you like to say in the office?
Gee, I don't know. I don't. Usually my jokes are about my wife, and if she hears this, she's not going to be very happy about that. So,
okay, wise pass on that question. Let's see. As dentists, we discourage the high intake of sugar. It's so prevalent today, right? But we all have our cheat foods. What's the favorite candy that you enjoy? And tell our patients why it's not necessarily good to have that all the time.
Well, I mean, it's not necessarily. I mean, we know that. We don't talk in dentistry. You go into your cardiologist, first thing they say is there a history of heart disease in your family? Is there a history of diabetes? We never really ask, are there dentures in your family? We never really talk about genetics in terms of ourselves. We talk about things we can control. We know we should brush better. We know we should limit sweets. And that's kind of important because that's what we can control. But genetics is, I think, a part. If you actually listen to the patient, that's an important thing. You start to ask them and they start to tell you, oh, my mother had dentures at age 50, my father always had trouble with their teeth. It's not because maybe they weren't brushing well, didn't go to the dentist. Maybe it was in the cards that the genetics, the immunoglobulins in our saliva, which help to prevent bacteria and help to fight off dental disease. Maybe the salivary flow is such, maybe they're taking certain medications. So, and maybe taking those same psychotropic medications, which is causing less saliva, Maybe the parents were taking the same medications. Maybe the grandparents were taking. So maybe genetics is a much bigger part of dentistry than dentistry really thinks about. And I haven't seen studies, perhaps there are, but I think we don't really ask parents, and I don't ask, and I'm not telling you that we need to ask. All I'm saying is I hate the blame game. It's not necessarily the toothbrush or the lack of fluoride in the water, it's life.
Yeah,
Really
absolutely, absolutely. So you're just gonna pass on the cheat food question also. Same idea. Will Nora be upset? Will she? She'll find your stash somewhere, and that'll be the end of it.
She's gonna find a corn muffin in the back seat, and I'll be in trouble.
Great. Let's see. What other question have I not asked you that you feel like you would like to discuss?
No. We chose a big gamut of questions, and and if you want me back again with something more specific, I'll be happy to do it. I just want to say that your level of expertise is tremendous. There's no
Appreciate
one that will approach an implant case with more knowledge and more expertise than you, and your level of caring is just tremendous. It's never about what I can do; it's what the patient needs. So I'm
Appreciate
really
that. High
honored
praise. Thank you.
to work with you all these many years.
Thank you very much.
And I knew your predecessor,
Yeah.
and we worked well together then also, and I hopeful to continue to work with you and mutual patients going forward.
Fantastic. Appreciate it. If patients want to reach you, where's the best place they can reach you?
You know what? Go find me. The object of this podcast is because I like talking about what I do, and I really don't want my phone to ring off the hook and get 25 people calling next time, and where am I going to put them? So I'm gonna pass on the corn muffin question. People will find me if they need me.
So, in the age of social media, that is the least likely answer to ever hear. And as we said, like, the real hero is never going to say, I'm a hero. The best dentist is not going to say, here's where you find me. The best one's going to say, try and find me. So this is Dr. Ronald Hecker.
And
Google will help you find him.
And don't look for, the patient that calls and says, well, I'm shopping for a dentist. How much do you charge for a crown? How much do you charge for an implant? I tell the patient, I'm going to be honest. If you're looking for the least expensive dentist, don't come here.
Absolutely.
Don't come here. I'm not trying to. Again, with my gray hair, I'm not looking to hire 3 dentists to work for me and keep my business busy. I'm busy enough, and and I enjoy new patients, and I love getting referrals from other patients. And this basically the source of my referrals, not from my website. Who knows? I don't even look at the website. If you want a wonderful website, go call Dr. Mickley, and certainly, any implants that you find Dr. Mickley to do, I'm more than happy to work with him, and we work together seamlessly.
Yes, absolutely.
Seamlessly, we discuss cases, discuss shades, discuss cases, discuss positions, how many implants are necessary, where to place them. Our phone is always ringing back
100%.
and forth, and I appreciate that rapport.
Okay, great. Thank you so much for coming down again. Really appreciate your time.
Okay.
Hope to do it again soon.
Thank you.
Thank you. It's great. Fantastic. I love that